How does manual therapy make your patients worse? I'm Dr. Michael Lee, founder of The One Method, and thank you for joining me today, particularly if you're a manual therapist, because you're probably thinking, yeah, that's happened to me. And it doesn't happen very often. I hope it doesn't happen very often, but ultimately what I hope is that you learn and ask why it happens, because you don't want it to happen ever again in your clinical practice. So the question here is, let's talk about the manual therapies first. So we've got acupuncture, we've got massage, we've got trigger pointing, we've got manipulations, right? These are the main manual therapies. Maybe even got active release technique for Graston. What else do we have? We have myofascial release. So we've got all these different types of manual therapies that people use, right, to move the structures around. And ultimately, when I'm looking at manual therapy, yes, it has a function. The main function it should be is a case of increasing mobility, so getting rid of scar tissue, that's the main function, but also in terms of helping in recovery. So in terms of moving the lymph system, and also moving circulation and bringing nutrition to the area. That's what's really important. Those are the two main areas that are needed in manual therapy. So if that's what you're doing, then great, keep going. Because I understand that all of these manual therapies I spoke about, yes, of course it's going to improve mobility. Yes, of course it's going to improve lymph. But the question is, how long does it last for? Because I would never, ever, ever recommend manual therapy to get rid of pain unless it's scar tissue. So there's a structural change. Because don't get me wrong, I'm not saying you can't manipulate. You can manipulate, but you need to supplement it with neurology, or at least some sort of exercise, or let's say exercise. You only can exercise or get a muscle to contract if the nerve's working, of course. So it has to be neurology first. You need to make sure the nerves are working to the relevant muscles to stabilize the area that you've manipulated, so it stabilizes better, right? Because the problem is with manipulation, guess what happens? It just stays, yes, mobile, but what the heck is stabilizing it? Nothing, because you haven't looked at that. Most clinicians don't look at that. So we need to I'm not here to upset chiropractors or osteopaths or physios that manipulate, but what I'm saying is we need to make sure we are looking at the complete package, so that we give the best service to our patients. So when this is actually happening, let's make sure that, yes, if you are manipulating something, or if you're trigger pointing, or you're releasing something, the first question you have to ask is, why is it hypertonic anyway? Why is it bracing? Usually it's bracing because it's there to stabilize something that's not working. And suddenly you release it, now what's happened to the stability? It's all gone. That's why people get worse symptoms after some manual therapies, because now you've destabilized the whole system. It just moves wherever it wants to move, and then there's going to be compression, there's going to be pain. So that's why you always need to remember, whatever you release, you need to find out, are you actually truly helping them in the long term? Because what you should be thinking is, when something's bracing, what is actually not working? Because whatever's not working, that's what's causing the thing to brace. So that's why when we look at neurology, we are looking at what is not working first, get it working, and guess what happens to the muscle that's actually bracing? Yeah, it stops bracing, because the thing that's compensating for isn't dysfunctional anymore, so it's got nothing to compensate for. And when that happens, we then make sure that the whole system is in balance, and we make sure it's consistently stable, so the patients can move forward with confidence. So this is where we need to be very careful when you're applying just manual therapy. Yes, it is a tool. I'm not saying it's a bad tool, but it's just a tool. It's a tool that can be used for a specific population, but it cannot be used for everything. Because don't get me wrong, I've seen a lot of patients that get manipulated, they get trigger points, they get massage for years. And then I still ask them, I say, so you've been massaged, you had this treatment for years, and why are you here? Oh, because it hasn't worked. So it's taking you a few years to realize you've been doing something over and over again that hasn't actually got you the result you want. That's the definition of insanity from Albert Einstein, right? Do the same thing over and over again, expecting a different result. But essentially, they've got the same result over and over and over and over again. Yes, I understand. Maintenance is important, but only maintain something if it's actually working. If it's not working properly at its best, that isn't maintenance. This is just patching something up. So that's why we need to make sure we're not patching up a patient's system, because patching up is just treating the symptoms. Don't treat the symptoms, treat the cause, because once you treat the cause, not only do you get rid of their problem or their pain, you also stop it from coming back. And that's when you can start doing the maintenance work, the manipulations, the massage, the soft tissue work. Yes, that's great to improve healing, recovery. That's great. That's what their class is maintenance. Manual therapy should be more about maintenance rather than treating. The only time it's used for treatment is scar tissue. But then again, would I use active release? I may do if I need to mobilize any scarring from an injury from, I don't know, maybe a nerve stuck, maybe a scarring around a nerve or around a joint. But then again, I could use shockwave as well. But the question is, which one is best for them? I'd probably use shockwave from my point of view, but I'm not saying ART or any soft tissue work is not helpful. It can be helpful. So this is where it's about picking and choosing what is best for the patient. But you must have the patient's best interest at heart. Yes, I get it. As a business, if you have a business, it may be, yeah, I need return income. But you do that when you're maintaining what you've got to the root cause. Don't do it at the beginning. Oh, just keep manipulating, keep massaging, even though I know it's not improving their pain. Because if you're at that stage, there's something you don't know. There's something you need to know. Because yes, I saw a patient today, right, that she had back pain for 26 years. 26 years, right? And we fixed it in what? One session, or I say 10 minutes. Because I found out actually psoas bilaterally wasn't working. It was hypotonic. As soon as I got them working, okay. Now she actually has stability at the front of the lumbar vertebrae, the pelvis, the SI joint, and the hip. She has stability now because it actually works. Because remember, if a nerve doesn't work, the muscle will never work. Now it works, and suddenly pain's gone because now I've stabilized the system which was destabilized before. So I hope this actually is making sense, because I'm all about creating the one treatment that people will need to get to the root cause of everything that goes wrong in someone's body. Yes, I had to study 7 degrees to get myself out of pain of being in a wheelchair for 2 years, but I had to figure it out myself. If you'd like to get the shortcut to understanding what I had to create after learning 7 degrees, we have a course later this year, early next year as well, where I can give you the fundamentals in terms of finding out what is helpful and actually helps patients get out of pain for good. If you're interested in that, just put me in the chat and I'm more than happy to help you, because yes, it is the first step to understanding how the whole body, the brain, is all connected together through the neurology. As soon as you understand that, then you have true power in unraveling any pain that someone may be struggling with in their body. So thank you so much for joining me today. If you have any questions, put them in the chat. But if you'd like to get more information about the course with some free gifts we're going to give you, just put me in the chat and we're more than happy to get one of our advisors to speak with you as well. Other than that, thank you for watching. Have a great week. See you next week. Bye for now.